Hi everyone, I'm Dr. Natalie Rahr with NeuroKids Canada. Welcome back to our monthly Q&A. I was going to address two questions actually this month. That's a very common question I get asked. Parents will ask me all the time, do I see whole families? Do I see parents? Do I see the other child as well, quote unquote, the other child, the neurotypical child in the family? So to answer that question around whether I see parents, yes, I very, very often see parents. So primarily my practice is based on treating any medical or health related patterns that are associated with neurodivergent diagnoses or neurodivergent traits, and helping children to just live their best lives and be as much themselves as possible without any of those things in the way. It is inevitable that when we're doing assessments and going through medical histories and speaking about the child's susceptibilities and how things declare themselves for the child, it is inevitable that one or both of the parents go, "Oh my gosh, that's me too," to some degree. Obviously presenting differently, but maybe for the parent presenting as anxiety and depression or difficulty sleeping or other things. So we'll talk about the nitty gritty around what's going on with their child and what's underneath everything. And they'll go, well, I've always had that deficiency as well. I've always been iron deficient, or I've always had digestive issues as well. And probably for me, it looks like something else, but causing some issues as well. So inevitably, I end up seeing parents as well. So the answer to that question is yes. And it's always very useful, especially if we're starting a protocol that's going to take several months for that particular child, the neurodivergent child in the family. It tends to be even easier if it means that the mom and dad, or at least one of them, is like, well, I need to do that too for myself. And so we'll go in depth into what their needs are, what their challenges are, that again are going to look unique, but may have similarities in terms of the root causes, the basis, right? The foundation of their health may be very similar to that of their child's. I will venture a step further into the fact that a lot of mothers I see, because I tend to speak to mothers all day about their children, and they tend to put themselves last. Usually we're talking about their children first, and then eventually they're saying, okay, it's my turn. I need to do this for myself too. A lot of, if not almost all the mothers I see, unless they're very young mothers, are going through perimenopause right now. And in that a lot of them are also discovering that they themselves have neurodivergent traits or challenges that are similar. I'm seeing a lot of perimenopausal ADHD type symptoms now, or other things, let alone the level of burnout that I see. So there's a lot to explore, particularly for the mothers, you mothers out there. And I urge parents to get care as well. Doesn't have to be with me, but to get care for themselves, for yourselves, because it's, of course, highly important. I mean, probably no one else is taking care of that child that has pretty high needs. And so that's for parents. And of course, very foundational to the health of the family. The other question around, do I do appointments for, or do I see value in treatment for the other child or the other children who are not diagnosed as neurodivergent and maybe don't have as high needs? This is another phenomenon that I do see, that sometimes, and very often actually, that other child or other children display some challenges that are unique to them, maybe based in anxiety, mood stuff, hyper responsibility, or feelings of hyper responsibility. Parents will say, gosh, they don't get nearly as much attention as our higher needs child. And that's very common. It's very normal, I would say, based on the situations that I see. And very often I do see that other child who is doing very well, managing seemingly well, eventually the mom or the dad or both will say, yeah, there's stuff going on for them too. and it might not declare itself as strongly for them, and therefore they don't get the level of attention because they don't seem to need it. Maybe they're really good at masking it. Maybe they also feel this really deep responsibility and love and care towards that sibling of theirs that they are always trying to connect with and care for, and so on and so forth. And so, yes, I do see great value, of course, in treating that child as well. Again, doesn't have to be with me, but I do urge parents to seek care for that other child as well, because they are also susceptible to some maybe neurodivergent traits, but maybe not. But challenges that seem to be unique, to this phenomenon, because it's a very real uniqueness in the dynamic. And the health issues that are foundational, like I said, for mom and dad, they might see themselves in it. Probably that other child is also experiencing something that just could be optimized just to help support them on their way. Maybe they don't need as intense care, but something. And very often they respond very well to the care that we provide, because their systems are maybe don't have that as high a level of challenging health issues as their neurodivergent sibling might have. So there's the answer to that question. At NeuroKids, we are all about the whole child and the whole family, because we want to look at all of those really crucial 4 pillars of health for everybody, so that everyone can thrive and be the best versions of themselves and just be as much themselves as possible. Okay, so thank you for joining me for this monthly Q&A, and I'll see you next time.